Hello everyone, you are all welcome to lecture number 1283, and today's topic is the application of telemedicine in healthcare system. When I am talking of telemedicine, it is combined and coordinated with different new technologies today. And those different new technologies, coordination is like artificial intelligence, robotic, and drone technology. And once they are combined together, it is becoming very useful tool and effective, especially in those areas where it is very difficult to reach. So once the patients who are in emergency, like in Gwaza or in Bamba or Kanduga, many places, some 30, 40, 100, 200 kilometers away, and where they don't have good consultants, they don't have good infrastructure of that is diagnostic center or some good labs, pathology lab. So in that circumstances, if there is any emergency, it is very difficult to reach. Secondly, it is very much cost effective in poor countries. The reason is that if suppose somebody is having some medical emergency like heart attack or some urological problem or neurological problem, any of the health condition, if they want to come to Maiduguri, it needs a lot of money only for transportation. Here I have seen it is the culture and tradition of northeast Nigeria that the patients are followed by 2-3 family members. They are coming in cities. This is what is happening. I have seen in many of the private nursing homes, hospitals, and also in teaching hospitals. So the whole family is uprooted, lot of cost. For example, exactly I don't know, but to my understanding, if you go to Gwaza and come back, it is a matter of 30 to 40,000 naira for one person. So to treat some medical condition, the whole family is broken. They have to sell their personal belongings up to the extent that they are selling their land or even houses to have the treatment. So this is very important area. And secondly, with this medicine, we can create lot of database with the help of iPhone, that is smartphone, tablet, and other electronic devices. And by creating the infrastructure platform in big cities like Maiduguri, like teaching hospital, we can create the visual screen and television set so that all are received here and images they are received. So all data is collected at the center, and now it's very effective. In India, what we are using, that is called drone toys. Drone toys means they are small size and it can carry up to 500 gram, that is half kg, or 200 gram medicine. And just by putting one small battery, it can go up to 30, 40, 100 kilometers to the targeted place, located place, and it can deliver. And there are big drones. Now what I am talking, that is what is happening in India. With the help of this telemedicine, lot of very poor people in very remote area like Gwaza Hill, Cameroon border, anywhere, once it is networking is done, we are well connected, network is there, team is sitting here in big cities, and the whole area is covered, where they cannot dream and think of getting A-class consultancy. with the senior doctors. And if any emergency is there, for example, in Gaza, if somebody has got some serious accident and he needs immediate consultancy, so with the help of telemedicine, telecommunication, data collection, immediately the people who are sitting here, those who are for this purpose, they will collect everything, put in roll, and within 15 minutes, delivery is given. It's very fast, just like aeroplane. Rather than if such emergency is there, like heart attack, like any other cardiovascular problem, and they need first aid, emergency aid. It has reached, at least they became stable. And after that, lot of remote sensing, remote imaging technologies that is included in your telemedicine. All the rural area is covered. So it is my humble request, or I can say appeal, to federal government of Nigeria, to state government of Nigeria, especially in northeast, where there are lot of remote villages, bushes we call them, and people are really suffering, where our 70% population, they live in rural area. It is our moral, religious, professional obligation. We belong to same human colony. We should have human feeling to reach to them. Even I am delivering why this YouTube lecture, because my lot of lectures are on chemistry for school children, for secondary school, for BSc Part 1, even up to PhD level. Why? Because if they cannot reach me, I should reach them. And medium is, that is YouTube, communication. Fastest, communication nowadays. So what I am saying, because this example what I have got is from India. In India now, big networking of mobile health, of electronic health, of telemedicine is created in many hospitals. In district level, team is sitting in front of the screen. Any emergency is there, they are all connected, networking is there, and drone is ready with battery. It's not big expenditure. You are not going to buy such drone where you are going to attack Gaza, or not Gaza, Gaza or in Russia or Ukraine war to take some explosive. No, it is for healthcare purpose, humanitarian purpose. Very small drone, just like toy. And Nigeria can afford, with 500 billion GDP, to create the infrastructure of telemedicine so that it can cover the whole rural area. We cannot get senior consultant like urologist, nephrologist, cardiologist, pediatrician, surgeons. Surgeons are doing surgery some 10,000 kilometers away with the help of robot and telemedicine. So at least we are in position with 5G, 4G infrastructures are created with satellite, remote sensing, remote imaging, remote delivery, with the help of robot, with the help of drone technology, with the help of artificial intelligence. And it is in action in many countries in Asia. So in Nigeria, it is high time to create the infrastructure of telemedicine to help the rural population where they cannot reach us. And it is very effective to 70-80% population who are poor, who cannot afford medication, who cannot afford consultancy coming to any big hospital. And at the same time, consultants cannot go there because it involves big money. And that money is drastically will become almost zero, negligible. Only battery, once it is charged, and that battery again, once after delivery, you can recharge it. 2-3 drones are ready at any moment. to attend any emergency. So these are all my, I can say, advice, and I am sharing my experience, Indian experience, what type of development is going on, how far it has gone. We can contact them. We have connectivity with US, with India, all advanced countries who are very much involved in telemedicine, teleconsultation, tele-delivery with the help of drone technologies and data collection. It can be created in Nigeria. It is high time. So I am going to show you some of the Indian drone delivery. So this is the drone delivery of medicine and different type of medical equipment, surgical equipment to attend the emergency in remote rural area in India. And this box can carry up to 5 to 10 kilogram. So all the emergency medicines are there and emergency can be attended. Here this is medium or big size drone which can carry up to 25 kilogram box, and it is going to deliver under this telemedicine delivery system to very remote area where even the car or any automobile cannot go, and transportation is very, very difficult and very costly. So all the drugs are reaching there, and this is all networking, is all controlled, remote controlled with satellite, and every point it is connected and it is attended. This drone with this barrel, blue color, is carrying lot of liquid material, including any type of blood if it is needed, all the surgical instruments, and it is going to deliver in remote area where they will get within 10-15 minutes time, and all the surgery, all immediate emergency will be attended. And once the patient becomes stable, and then the information will be passed on the basis of data, on the basis of consultancy, and consultants will be there where the platform is created, and it will be communicated, and all the emergencies will be taken care. So what I have discussed is given in the form of summary abstract. Number one, telemedicine, also known as telehealth or e-medicine, is the use of electronic communication, smartphones, video conferencing, remote imaging, and electronic message apps to provide healthcare services in remote rural area for poorest of the poor population, that is in any country, especially in northeast of Nigeria, those who are living in, I am always quoting that area because I have visited once, that is called Gwaza Hill. It can reach within 20 minutes time. Number two, types of telemedicine. There are different types of approach of telemedicine. Number one is that is called real-time telemedicine. It means that it is live interaction communication between patients and healthcare providers, those who are involved, those who have created infrastructure in hospitals, often by use of video conferencing. Number two, that store and forward telemedicine. It means synchronous communications. Synchronous communication means transfer of data and information between patients and doctors by sending medical information by video image. Number three, remote monitoring is the continuous monitoring of patients' vital signs and their emergency and collection of data. Number four, mobile health is already given here. If you go to Google or any place, small m, lower m, and health, that is called mobile health. And in that service, the use of mobile devices such as smartphones and tablets to provide healthcare services and access to medical information to remote area. Number 3, that is benefits of telemedicine. What are the benefits? Biggest benefit is that you can provide healthcare service emergency to poorest of the poor who are neglected, who cannot afford to come to Maiduguri or Abuja or Kano, and you are reaching there. So that is benefit is number 1, increase access to rural area, and number 2, improve conveniences. Poor patients can receive medical treatment in their home, in very much comfort zone in their village. Number 3, cost saving. It is cost effective. No need to come and hospitalize and lot of transportation money. This I have already told you a lot. Then primary care, routine checkup, management of chronic diseases in rural area, and then specialty care. Specialty care means consultants cannot reach there, but with the help of telemedicine technology, all the information will be reaching there and diagnostic procedure will be followed by all these super specialists like pediatrician, urologist, cardiologist, nephrologist, and also those who are super specialized in blood and liver, lung, and oncologists in cancer, all this. So once we are talking of telemedicine to create its infrastructure in Nigeria, in the beginning we have some challenges, and these challenges are the signals, poor networking, we have to go for 5G, poor videography and images. So here I have given number 4, challenges of telemedicine. Number 1, technical issue. And in that technical issue is that is connectivity and poor network and video quality. And number 2, privacy. Privacy is very important. Here if you are doing all this videography, data transfer, and some of the head of the state or chairman or some politician or anybody who is very, very important, whose health secret should be very much confidential, strictly, that has to be maintained. That also one of the challenge. The third is patients' acceptance is difficult in rural area, especially in Nigeria, because of their very old tradition and values, and they are not ready to accept any new technologies. That is the problem. So this we have to face. That is patients' acceptance, especially in Nigeria, rural area, people are very traditional. They are hesitant or resistant to adopt new technologies like telemedicine services. Number 5, important role of drone in telemedicine delivery. I have already showed you the images of different type of drones, very small size, medium size, big size. It depends upon what amount and what type of instrumentation or surgical devices you are going to deliver in a remote area. So number 1, its importance is that rapid delivery of medicine equipments in within hour or within 30 minutes. And number 2, enhanced access of very, very poor rural area people. It is the biggest benefit to poorest of the poor in remote area or rural area. And number 3, medical data transmission. Data will be available, and with that transmission you can deal all the chronic diseases. And number 4, search and rescue. This drone technology is also very much useful to search in remote area and to have surveillance to handle the even those people who are mentally challenged, they can be treated. Note, this very important note I have written in bold. Drone may be integrated with other new technologies like artificial intelligence and Internet of Things, that is IoT, to accelerate teleconsultation and its capabilities. In this way, new business models can be created to support the drone platform and infrastructures. Actually, this area, if we are going to create the infrastructure for 220 million people, where 70%, more than 100 million population, they are in a rural area. So lot of youth will be trained and they will be knowing lot of new technologies, new applications and new type of approaches, and it will motivate them. It will create the employment, so that lot of people will be engaged in this telemedicine infrastructure platform, starting from city up to rural area. That is to support the drone platform and infrastructure as drone-based medical delivery services. So there can be a big platform that this center is dealing with drone-based medical delivery services, and they can approach there, and it will provide the expansion of new net markets, opportunities, possibilities for young generations, researchers, and for the development of a rural area healthcare system. So, in the last but not least, I wish and I appeal the state government, the federal government, let them come forward and create the infrastructure for telemedicine, where we can deliver lot of medical services, medication to poorest of the poor in rural area. Once again, thank you very much for watching the lecture.